and welcome back to another one of my videos. Today we are going to be demonstrating how to insert a Foley catheter. So the first thing that we're going to do is we're going to verify our doctor's orders. We're looking to see if there's any contraindications as to why this patient cannot be having a urinary catheter inserted, such as urinary strictures. And then the next thing we're going to do is we are going to enter the patient's room. We're going to knock on the door. Knock, 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 and we are going to introduce ourselves to the patient. So, knock, knock, knock. Hello, my name is Destiny. I'm going to be your nurse today. I'm going to perform my hand hygiene. I'm going to provide for the patient's privacy. So if there was any people visiting her, I would ask them at this time if they could please step out, and I would also close the curtain around the patient's bed to ensure that nobody accidentally walks in on us doing this Foley catheter insertion. So next I'm going to identify our lovely woman here, and we're going to look at her wristband. Can you tell me your name and your date of birth? She says, yes, my name is Taylor Lynn. My date of birth is November 27th of 1968. Okay, and I look at that and I compare it to the MAR, and this is the right patient. The next thing I'm going to do is I'm going to ask Miss Lynn here if she has any allergies. So, do you have any allergies? She says no. I ask her, are you sure you're not allergic to iodine or shellfish? And she says no. That's fantastic. So now I'm going to explain the physician's order to the patients, and I'm going to make sure that she agrees to having a urinary catheter inserted. So, Miss Lynn, we're going to go ahead and insert you a Foley catheter today because you are having urinary retention. Is that okay with you? She says, yes, that's fine. Next thing I'm going to go do is I'm going to go find the bladder scanner. So I'm going to go find the bladder scanner. I'm going to scan her bladder. If I couldn't find the bladder scanner, I could also palpate her bladder. And yeah, she definitely needs a urinary catheter to get rid of this distension. So the next thing I'm going to go do is I'm going to go find a catheter that matches the doctor's orders. We're going to always want to be using the smallest catheter possible for our patient. So we're going to go find our catheter. We're going to perform a hand hygiene. We're going to find our catheter. We're going to make sure that this is the right one, and we're going to compare it to the doctor's orders. Make sure it's the right size. It says yes. We're going to make sure that it's never been opened before and hasn't. We're going to perform our hand hygiene. We are going to prepare the patient to have the urinary catheter inserted. So the first thing we're going to do is we're going to take our towel. We're going to put it underneath our patient. The second thing we're going to do is we're going to drape our patient for a patient's comfort and make sure she doesn't get cold or anything. The next thing we're going to do is we're going to perform our hand hygiene. We're going to put on our gloves. So we're going to help the patient into a dorsal recumbent position. We're going to make sure her knees are flexed and relaxed, and she is laying on her back. So we're going to do that now. She's on her back, her knees are flexed. We're going to uncover her bottom. We're going to grab our water. We're going to make sure that it is the right temperature. We're going to ask her if this is okay. Miss Lynn, is that okay? She says yes, that's a good temperature. So now we're going to we're going to perform our peri-care on our patient. We're going to dip this in the water. We're going to make sure it's not soaking wet. We're going to clean the side closest to us. We are going to use a different side of the towel. We're going to clean the side farthest away from us. We're going to use a different side of the towel. And we're going to clean down the middle. And while we're doing this, we're also identifying the meatus. So this is difficult to do sometimes, so we can get a light and we can look. Now we're going to pat the patient dry. We're going to make sure that we're always wiping from front to back to not give our patient urinary infection or urinary tract infection. So now we're going to remove our gloves. We're going to throw them in the trash. We're going to perform our hand hygiene. And we're going to start opening our kit. So we are going to open it, tear it, open it, get it out of its package. We are going to take this plastic bag, we're going to turn it into a trash can. going to put this at the end of the bed, facing up, so that we can just throw stuff in there. Next thing we're going to do is we're going to grab our catheter kit. We're going to start by opening it the farthest side away from us, and making sure not to contaminate our sterile field. And then lastly, we're going to pull the side closest to us down. So now, what we're going to do is we're going to use the crane position to get our gloves and our patient's shiny thing. So we're going to do this, and we're going to open this up, and the shiny part goes face down. So we're going to ask the patient at this time, can you please lift your hips? She lifts her hips. This goes straight underneath the patient. So now, we are going to perform our hand hygiene, make sure our hands are nice and clean, and we're going to apply our sterile gloves. Making sure not to contaminate anything, we're going to grab our sterile gloves. Okay, now the next thing we're going to do is we are going to grab our lubrication. We're going to squeeze that out onto our sterile field. We're going to throw this in the trash. Next thing we're going to do is we're going to grab our iodine. We are going to put that all over our cotton balls, make sure that our cotton balls are nice and soaked, and we're going to throw this in the trash. This thing did not want to stay up. Okay, the next thing we're going to do is we're going to scoot this little tray over. We're going to make sure that it's still within the sterile field. And we are going to take off this piece of blue paper off of our urinary catheter. We're going to throw that in the trash. Next thing we're going to do is we are going to grab our 10cc syringe, and we're going to plug it into our urinary catheter. And now we can begin cleaning the patient. We are going to grab a cotton ball. We are going to clean the side is closest to us, and we are going to throw this in the trash. Next thing we're going to do is we're going to grab another cotton ball. We're going to clean the side furthest away from us, and then we're going to throw this cotton ball in the trash. Then we're going to grab another cotton ball, and we are going to go from front to back, down the meatus, making sure everything's clean, and we're going to throw that in the trash. And then one more time, we're going to grab the rest of our cotton balls, whatever's left, and we're going to do the same thing again. Clean the middle. And we're going to throw all that in the trash, including the little clippy thing, the forceps. Next thing we're going to do is we are going to grab our urinary catheter. We are going to make sure that we get this all lubed up, at least 1 to 2 inches. And then we are going to take it, and we're going to take the whole sterile field. We're going to get as close to the patient as possible with keeping everything sterile. We're going to try to keep everything sterile. And we're going to insert the catheter. We are going to, with our non-dominant hand, we're going to open up the labia, and then we are going to insert our catheter. We're going to pull back, pull back, pull back, and we're starting to see some pee. I'm going to go 1 more inch in. I'm going to take my non-sterile hand, and I'm going to push in the fluid with the 10 cc's, and I'm going to make sure that I'm not contaminating my sterile urinary catheter. And then I'm going to pull back, make sure that that's in place. I'm going to push it back in. Now we are done inserting the catheter, and we can take this out of the box. We're going to drape this across the patient's leg, and we're going to apply a Foley anchor to the patient. Next thing we're going to do is we are going to go ahead, at this time, we're going to take off our dirty gloves. we are going to perform our hand hygiene. We're going to take the bag. We are going to make sure that it is hanging on the bed. We're going to make sure that the urine is flowing and not obstructed. We're going to make sure that there's no kinks in our catheter. We are going to we're going to perform our hand hygiene. We attach the catheter to the bed frame. We check the tubing to make sure that the urine is not obstructed and it's not kinked. We're going to help our patient into a comfortable position. So Miss Lynn, are you comfortable? She says yes. I'm going to cover up my patient with the covers. I'm going to make sure she has her call light so she can call us for help. I'm going to make sure she has all her personal items and her toiletries. I'm going to make sure that the patient knows how to use her call light to call us for help. I'm going to raise the appropriate number of side rows. I'm going to lower the bed into the lowest locked position. I'm going to dispose of all the supplies in the appropriate receptacles. So all of this is going into the trash. I'm going to leave the patient's room nice and tidy. And then, before I leave, I am going to do my hand hygiene again. And I'm going to tell the patient, okay, Miss Lynn, if there's anything else I can do for you, please let me know. And then I'm going to go ahead and exit the room. Alright, thank you. I will probably see you next semester. And have a good rest of the day. Bye.